How can psychological first aid help secondary trauma? Have you ever wondered how to support someone who is affected by trauma, especially when they are not the direct victim? This is where psychological first aid comes into play. Psychological first aid is a method designed to provide immediate emotional support to those impacted by traumatic events. It is particularly useful for individuals experiencing secondary trauma, which can happen when someone develops trauma symptoms through exposure to others' traumatic experiences. This is common among first responders, healthcare workers, and even family members of trauma survivors. So, how does psychological first aid help with secondary trauma? First, it aims to reduce initial distress. When someone is exposed to traumatic material, their emotional response can be overwhelming. Psychological first aid creates a supportive environment that fosters safety and connection. This environment allows individuals to access social and emotional resources that can help them cope. One of the key aspects of psychological first aid is that it does not involve formal treatment like psychotherapy or counseling. Instead, it focuses on practical assistance. This can include simply listening to someone without pressure, providing information, and helping them meet their basic needs. It also connects individuals to further support if necessary. This approach is flexible and can be applied in various settings, whether at work, in healthcare environments, or community centers. By providing this kind of support, psychological first aid helps to mitigate the emotional impact of secondary trauma. It addresses acute stress reactions before they interfere with daily functioning. For example, individuals may experience intrusive thoughts, emotional numbing, or avoidance behaviors. Psychological first aid can help prevent these symptoms from escalating. Moreover, this method encourages resilience. It helps individuals regain a sense of control and normalcy, which is essential during crises. Organizations can also benefit from incorporating psychological first aid training for staff who may be exposed to trauma indirectly. This equips them with skills to support themselves and others, maintaining well-being and effectiveness during challenging times. In summary, psychological first aid serves as an immediate and accessible tool to address the emotional toll of secondary trauma. It supports recovery and maintains mental health for those indirectly exposed to trauma. Whether in personal, business, or global crisis situations, this approach can make a significant difference in how individuals cope and heal.